Hello, everyone. Welcome to our January chat. We are so happy to get this series started again for 2026. But before we
Yes.
get into this month's topic, I just wanted to make sure that we were clear and set some ground rules that we are not
Mhm.
sharing any specific patient information when we bring
Right.
up stories or talk about anecdotal information from our clinic. We have a combined almost 40 years of experience and years of seeing patients in our practices. So a lot of the things that we'll bring up is just a combination of things and themes that we've seen. So we want to be sure that you all are confident, especially if any of you happen to be our patients, that we're not sharing your specific information. We are just using examples of things that we've seen over the years. And with that, I'm going to hand it to Dr. Akita to get started.
So yes, thank you, Dr. Emily, for that introduction into this segment, into our January chat, in which we're going to talk about cervical health awareness. I was telling Dr. Emily, it's really hard for me not to bring the contribution of Mrs. Henrietta Lacks into this conversation. Look her up
Definitely.
later, but briefly, Mrs. Henrietta Lacks was a Black woman who lived in the Baltimore area and sought
Hmm.
care at Johns Hopkins for what ended up being cervical cancer. And she had a
Hmm.
really aggressive form, but the scientists used her cells and applied it to many areas in healthcare. And that's how we have a lot of our modern day advances. And so this was done without her consent, without her knowledge, and that of her family. But
Hmm.
years later, decades later, so much of what we are privileged to have in healthcare today is because of her
Because of
contribution.
her.
So,
Yeah. Her cervical cells, again known as the HeLa cells, were used to help develop vaccines, cancer
yes,
treatments, major medical breakthroughs. But the important thing is she never gave her consent for her cells to be used. And of course, unfortunately, she passed away, and her family just didn't even know what was happening for decades. And
right.
so these companies making money off of her cells while her family lived in poverty. So it's definitely an interesting story. And we bring that up because history matters, right? Because trust
Yes.
in healthcare still doesn't exist very well now, and it doesn't exist in a vacuum. It's shaped by experiences, whether they're personal, familial, or historical. And acknowledging what happened doesn't mean that we have to stay stuck there and get all angry and all of
Right.
that. It just means that we can move forward informed, not only as your primary care doctors, but for you as well as a patient.
Yes, yes. One thing that we have come to learn in medicine through the years is that cervical cancer is largely preventable. With
Hmm.
proper screening, we can catch things before they really get aggressive, before the cancer spreads. But this
Right,
takes screening. This
right.
takes access to care. And we still see disparities when it comes to cervical health. So let's talk about who gets screened, how early to get screened, and the frequency in which women need to be screened. Nearly
Yes.
all cervical cancer is caused by HPV. There is a small subset that is not, but for the most part, it is caused by HPV, and that is a virus that is extremely common and is
Hmm.
spread through sexual activity. And so a lot of women may get exposed at some point, but the exposure is not obvious. There are not obvious signs and symptoms. And so that is why screening with the pap smear is important to catch things before they progress.
Definitely. So let's talk a little bit about statistics in the United States specifically. So about 90% of cervical cancers are linked to high risk HPV strains. So when you get a pap smear performed based on age, and we'll talk about that, sometimes if you are younger, your pap will be checked just to see if there are abnormal cells and then to see if there's a presence of the high risk strain. And that may be done only if you have the abnormals, and there's a reason for that because younger women will clear the virus faster than older women. Another key statistic is that Black women are more likely to be diagnosed at later stages. I see it all the time, and I'm sure you see it as well, Dr.
Yeah.
Akita, that older ladies, they either fall off, they feel like they don't need it anymore. Some women in stable relationships are like, oh, I've been in this relationship for X number of years, I don't need it. And it doesn't mean that they necessarily got it from that partner. It could have been dormant for years before it shows up. And finally, the more likely to die from cervical cancer are those who do not have access, they do not follow up, or there are gaps in the system. think about it. If there's a patient who, they moved or they just haven't gotten their PCP, the old PCP calls them, they can't reach them. That's someone who's lost to follow
All
up.
right.
This is why awareness alone is not enough. You have to take action and it matters.
Yes. As you were talking, Dr. Emily, I was thinking about the few cases of cervical cancer that I've seen in my career. And it was
Yeah.
either somebody who was lost to follow-up, who had a
Mhm.
long gap in screening, but it was one of those situations in which you talked about. So this is something that we can actively do something about to prevent cancer. Mhm. Now,
Agreed.
when our careers first started,
Mhm.
the guidelines were different for screening for cervical cancer. I remember we would
Yes.
tell women you start screening like a year after sexual activity began. And
Mhm.
then through the years, we've seen the guidelines change and change and change. So let's talk about now what the current guidelines are. This is not substitute for talking about it with your own doctor and
Right.
seeing what pertains to you. But generally speaking, now we start screening at age 21. And then
Yes.
from the ages 21 to 29, the screening is every 3 years with a pap smear. After age 29, so like around age 30 to up until age 65, the screening
Mhm.
is done every 3 years with a pap smear, but it can be stretched out to every 5 years if there's HPV testing. And then
Right.
if there's co-testing, meaning the pap and the HPV testing, it's every 5 years.
Mhm.
So the guidelines or the screening guidelines can be different if there is a personal history of abnormal pap smear, which is why it's important to talk to your doctor about it, about your particular
Definitely.
screening needs.
Yeah.
Mhm.
So have you had, and I'm sure you have, Dr. Akita, because I have it all the time, a mother will call in and say, oh, I just found out my 16, 17-year-old has had sex. And does that person need to come in and get screened? What do you say to that parent?
I say, according to the guidelines, no, that would be a time to prevent maybe transmission of HPV
Hmm.
through vaccination. But as far as screening, no, not with pap smear.
And then my favorite is, oh, I'm used to getting my pap smear every year. I want to come in and get it. And while I often, because a pap smear, we talk about healthcare costs rising, right?
Yes.
In the grand scheme of things, the actual pap test is not very expensive. However,
Mhm.
how do you address those women who they're like, I want my pap every year?
Reassurance, because
Hmm.
through our careers, we have seen that even if there's an abnormality, for the most part, a lot of things can be slower growing. So if a
Right.
woman has had normal screening,
Hmm.
reassurance, your cervix was normal a year ago, it likely still is because there are no new partners, no new
Right.
exposure risk.
Hmm.
And, we have seen recently where a lot of insurance companies have stopped covering
Yeah.
the cost of the pap smear. So even though it's not
Right.
the most expensive test in
Hmm.
medicine, now we're seeing some denials for coverage because the screening time is not appropriate.
Yeah. Very true. So I think the key in this conversation we've had back and forth on this particular part about screening is for you as a patient to stay engaged. Talk to your
Yes.
physician, and you can get your annual PAP or your, every 3-year PAP done by your primary care physician, or if you are a woman who's still seeing a gynecologist, either one. And then make sure that if it's a gynecologist, that they're sending that report back to your primary care physician,
Yes.
because again, if you're not seeing your gynecologist, but those every 3 years, and sometimes things can get lost. So you mentioned the vaccine. So I want to just clear the air about the
Yeah.
vaccine. We ain't fighting with y'all about vaccines. That's not the point of this. But we just want to talk a little about the vaccine, because how can we not talk about cervical health without talking about the HPV vaccine, right? So, just quickly, a quick story from a family friend who is now an advocate for cervical cancer. So, even though I'm still not going to say her name, she is very much out there and helping to bring about awareness. But basically, she was in between her routine PAP. And she had had an abnormal before, but it had cleared. So she's in her late 20s at this point, and she just had some weird vaginal symptoms, nothing that she thought was out of the normal. But she ended up getting another PAP just because her gynecologist just wanted to be sure, just because she'd had these weird vague symptoms. And it ended up that she had an aggressive cervical cancer and had to have a hysterectomy. So I say all that to say that yes, the routine screening, we follow the guidelines, but as the patient, we still want you to know what's going on with your body. Is there
Mhm.
something new and different so that we can make those steps and say, hey, no, we have a reason to do your PAP before you're due? So I did want to share that as well.
Yes.
Because as we talk about HPV vaccine, it is cancer prevention. And we know that, like, that is not up for discussion. It's
Yeah.
recommended for preteens. I believe the recommendation is you can get it as early as 9. I typically will give it to my pediatric patients who come in for their 11 to 12-year visit because they're
Right.
already getting other vaccines. It's recommended for teenagers. That story we talked about, a mother says, hey, I just found out my son or daughter is sexually
Right.
active. What do we need to do? We need to talk about safe sex. We need to get them the HPV vaccine. And finally, adults up to age 45 can also get the HPV vaccine. It used to be that it stopped at
Yeah.
26, but is now indicated up to 45 because HPV is widespread. So we know the vaccine is cancer prevention. It does not encourage sexual activity. Just because you give your teenager the HPV vaccine, and this is a conversation I have, you're protecting your child before they need it, before they make a decision to become sexually active. So it is, in general, safe and well tolerated. Most of the side effects are mild and transient, meaning they're not going to last a long time. Yes, you hear those stories about these serious adverse effects, but they are extremely rare. And I'm talking about like 0.1% of
Mhm,
people who
mhm.
get the HPV vaccine can have those serious side effects. Also, there has been no link to chronic conditions thus far, and the HPV vaccine has been out for quite a while.
Yeah.
So, what I would say is you have to look at the risk versus the benefit. Having the potential to have an HPV related cancer versus the very low risk of a side effect means that you should strongly consider vaccinating your children at the 11-year-old visit, teenagers, if you're a single person who is not yet married, or if you are married and you have not yet reached 45, I would strongly consider getting the HPV vaccine, and I recommend you do it.
Yeah, you made a lot of good points. One of the things I was thinking about is sometimes when we're talking to parents, they'll talk about their own child's sexual history, but then
Hmm.
we have to consider the other partner's history, so
Right. That's
it's
good.
not just about the individual, but it's what will that individual come in contact with.
Yep.
Um, yeah, so yeah, thank you for breaking it down that way. And when we think about screening, we think about cancer prevention. Um, you know, we started off our career in an underserved population.
Hmm.
And actually, where we were working, we partnered with the health department really
Yeah.
seamlessly. It was a great
Mhm.
partnership. And then after I moved to Atlanta, I again worked with a similar population. But one
Mhm.
thing that I've seen through the different states and cities I've worked with is lack of insurance does not have to be a barrier to care. A lot
Yes.
of times when we see women skip pap smears or skip their preventive
Hmm.
exams, it's because there's a
Hmm.
gap in coverage. But
Right.
there's so many resources that are out there, like the local health department. We both
Hmm.
worked with the health department when I'm in Charlotte.
Hmm.
And then there are FQHCs, which are federally qualified health centers. And so these are places that are designated to serve people who are uninsured or underinsured.
Right.
And so there are a lot of FQHCs all over the US that are
Yes.
built, they're purposed for serving populations that need access. There's also Planned Parenthood where women can get pap smears. And then
Mhm.
there is the CDC's a National Breast and Cervical Cancer Early Detection Program, which can offer low cost screening, free or low cost screening for cervical cancer. I
Yeah.
know in my office here in Atlanta, we the lab, you mentioned it earlier, the lab cost is not that high for pap smears. And I think a lot of women are surprised when I can say, no, about $30 or less. And
Yeah.
so that plus the office fee, you can have cancer screening a lot of times for less than you think. So yeah, there are
Yeah.
many options. And we can be a resource. You can leave a comment if you need help in your area or Google or whatever,
Mhm.
but we don't want lack of insurance to be a barrier to care.
That's right. I totally agree. And just Planned Parenthood is healthcare. They're
Yes.
primarily to help women get the care that they need that they may not have other resources to do. So,
Mhm.
yeah. So we're in a time that's a great seg because it was like, oh, the CDC not sure what's going on there. And that's not
I
what this
know.
video is for. But so we're in a time where the healthcare systems are changing, trying to figure out your coverage, your cost, your access. Waiting for someone else to manage your healthcare is not what we're doing in 2026. Okay. We're not doing
Mhm.
that. So taking charge of your own health is important. But what does that mean? One, know when you're due for screening. Even if you're not sure, call your PCP. You could even call the health department and they will help you figure that part out. Ask for copies of your results. That's another thing that I tell patients all the time.
Yes.
You want to, especially if you are going into a new relationship, you want your copies of your testing. You want to see copies of their testing. You don't just want to say, hey, yeah, I was negative. Mm-mm. No, you need to see with your own eyes that they were negative and you want to show them the same. Follow up on abnormal tests. If there's something that your doctor has mentioned was abnormal or something that you see and you just haven't heard from them yet, be prepared with your questions. We love it when our patients are ready to ask questions versus, the visit is over, the phone call is over, and then you call back saying, hey, I saw this or I looked this up on Google. Ask us questions about your abnormal test. We want to explain it to you and we want to make sure you understand. Advocate for yourself, even when it's uncomfortable. Just like the story I told you about the family friend, luckily she had a doctor who listened to her because that doctor knew that she would not be coming in if she didn't have these weird symptoms. Advocate for yourself. Make sure that your doctor understands what you're saying. And sometimes, you have to say, hey, no, I really want an appointment so I can speak to my doctor. So advocating for yourself, I can't say that enough.
So, in closing, in honoring Henrietta Lacks doesn't mean let's stir up a lot of fear and mistrust. It just means that we need to have informed empowerment. Cervical
Yes.
cancer is one of the most preventable cancers that Dr. Emily and I screen for as a primary care physician. So,
Yeah.
screening saves lives, vaccination saves lives, and
Yes.
follow-up saves lives. I really appreciate the talk that you were giving about being an advocate. If you are in a
Mhm.
healthcare situation with your doctor, with the healthcare system in which you're unable to advocate for yourself, you need to
Mhm.
reconsider that relationship. We want you
Mhm.
all to be empowered to ask the questions that need to be asked and to feel comfortable about your health. And
Mhm.
especially in this moment, we want you to know that your health is worth protecting, that your
Yes.
voice matters, and that
Mhm.
prevention is power.
It is. Totally agree. Before we wrap up, we would love it if you would follow us on our socials, especially if you want more of Dr. Emily and Dr.
Mhm.
Akita. You can follow me on Instagram, Facebook, and TikTok. I am your friendly neighborhood family doctor.
And on Instagram, Facebook, and TikTok, I'm at Dr. Akita Evans.
So if this conversation helped you or it really struck a chord with you, we would appreciate it if you would share it with someone you love. You can share it on Facebook. You can share it everywhere. Because if you're overdue for screening, let this be your
Yes.
reminder. Let this be your friend's reminder. Let this be your family's reminder. This is an important conversation. We want you to take charge of your health. We want you to stay informed and take care beyond the exam room.
Yes.